Okay. I am doing another audit of the COVID-19 Healthcare Coalition dashboard. Erica and her team at MITRE had asked me to take another look at this project, which they've been working on for a few months. You might have seen some of the early audits that I did on this, or at least one of them is posted on YouTube. So I just pulled this up. I've not looked at it since Erica sent it to me. And I'm going to share my screen. And let's see. And here it is. Okay. So you guys should be able to see the dashboard here. Again, this is the COVID-19 Healthcare Coalition decision support dashboard. I think this is a great project. It's doing a lot to show trending and putting qualitative ranges and scores on the different metrics that people should be paying attention to. I do check into this. I'm getting ready to go on vacation, so I was checking it out actually just this morning before they emailed me to take another look at it. So, okay, so I can tell you, well, let's see. I live in Middlesex County. So let's take a look at Middlesex County, Massachusetts here. Looks like this stuff is new. I remember earlier I got this pop-up screen, this like, I feel like I get that every time I come. I don't know why that's not cookied. Maybe it is cookied and I was looking on my other device. I think I remember some of the rendering on iPhone was also a little bit wonky, but okay, what do I want to know more about? So I'm taking a look at this blue area here. Outbreak status, vulnerable populations, social distancing, healthcare system, telehealth. So personally, I guess I'm right now outbreak status. I'm not as interested in this. Social distancing. I'm guessing this is here because journalists or there's certain personas who might want to select these things. I understand what it functionally is doing. I feel like this. I don't know. Right now, I want to almost have this choice come later after I've seen information. I don't know if I want to select this at this point in the journey. I kind of want to see the information first. So I'm hoping this probably cookies itself too. I would think that I would want this to be the same every time I come in here. So I don't care about telehealth for now. I'm just trying to get a kind of a score. So I feel like just right off the bat, this added complexity here. I didn't have to think about all this the last time I came. So now I feel like I'm back to kind of a lot of thinking about what I'm supposed to do before I've gotten any value out of this yet. So I'm going to remove this too. I'm actually playing with it to see if something on the screen is changing. So that kind of feels weird, maybe because I haven't picked a location yet. So I did see how you guys change this so it doesn't just automatically add the selected county to the area. I'm still going to comment on this just because I feel like it's necessary. The map just doesn't do a whole lot. I kind of wonder why there's still such a focus on this map. I feel like this tool is much more relevant to people checking the places they live on a regular basis, and not just randomly coming in here to compare visually what's going on. I don't understand why there's a focus so much on the map interface. It's getting too much real estate, too much attention, in my opinion. So, but I'm going to go ahead and add this here. So actually, I wanted to comment on that rendering. There's like some latency there, although my CPU seems like my fan's running crazy, so that might be why it's slow. I don't know what these bars are. It almost looks like a number though, like 11105. I don't know if this is like a visual delimiter or something, but I don't know what these light blue and yellow vertical bars are. This type too, I'm using Safari right now. This type is super small to read. It's also probably not acceptable from a contrast perspective here. And it just overall, this feels very crammed. The type size is small, even just the margin on this. I'm really getting into the GUI nuance here, but just expanding the margin here, the white space between the dialogue and the content, and just letting it breathe a little bit, I think might help. And I would probably also do a little bit more to fade out some of the area around this dialogue, that the shadow that's being dropped here. It's just either that, or you could also put some opacity, reduce the opacity of the map when this dialogue is open. But right now it's feeling visually a little bit heavy, if that makes sense. Anyhow, so I added that here. Maybe I'll go ahead and add my birth just for comparison here. I'll see how my birth city of Phoenix is doing as well. And I remember I think I'm supposed to type in a county, but let's see if it figures out that's Maricopa County. Map seems to be loading fairly slowly, but again, that could be my computer. Search result, Phoenix, Arizona. So I'm way zoomed in here. I don't know why I'm so far zoomed. You might want to oh, maybe it's just not rendered the detail yet. Okay, well, I would have expected this to pull up the count to resolve to the county. I'm going to go ahead and skip that, but you guys can work on that. So I'm going to type Maricopa County. There it is. I want to see comma delimiter. Like I don't like seeing these large numbers without commas, or you could just put K, 132K. I don't know how much the precision really matters here at this scale. Oops, sorry, that's me double clicking on my mouse that zoomed in. So I'm going to add this. Okay. Expand the trends. Okay, that looks like it's new. That did not do anything. I don't know if there's a rendering issue. So the button state changed. I didn't see any type. I expected to see those sparkline, the small multiple charts appearing underneath these areas. I'm not seeing that. I'm going to hit collapse. The cursor also is not changing. Yeah, there's definitely some lagginess here. This could be my computer. The fan is running. I'm going to kill a couple things, a couple windows real quick. Sorry about this. Let's kill this guy. And this. And this guy. And this. I had a lot of stuff running. Apologies for the delay here. Okay, hopefully that'll work. So I'm hitting expand trends again. And yeah, I don't know. Something must be broken here. Okay, so down here, it looks like it worked. Okay, so there's an issue with feedback, right? We call it feedback. So when I'm interacting with this, I need to be aware that something on the page has changed, and right now I'm not aware of that. So I think you need to work on this pattern so that this button doesn't feel like it's not doing anything. I realize now what it is doing. It is expanding the trends down here, and now I'm realizing that you're not trending all the information, but that gives the feel that this button does not work. It feels like it's broken. So I love that there's a sticky header now, that you've implemented this sticky header. We're not repeating these the county headings every time, so that's great. Okay, so I'm gonna actually pay attention to the data now and see what the story is here. So it looks like our reopening risk score is not great. I'm gonna make the same comment I did about these dialogues. They feel very heavy. Just the shadowing and the graphic design, it just feels prototypey. So if you guys can maybe work on the rendering, it'll just help with the overall feel of this thing. But there's no shadow on this dialogue. It's not clear how to close it. It's quite heavy. But I'm very much nitpicking on some of this aesthetic stuff. So got it. The overall risk level based on an aggregation of key metrics. So I think when I saw this morning, I kind of wondered if is this forecasting? Is this forecasting what the risk is to go to the next level of, they have these tiers. I think Massachusetts is like in phase 2 or whatever, going into phase 3. So it's like, is that normalized across? I don't know if that's a federal standard or if that's like a state. I'm guessing it's a state standard since we don't have very good federal coordination on all this stuff. So, if both of them have a four phase system, or let's say Maricopa has a 5-stage and Mass has a 4-stage, are you saying that it's a medium risk for whatever the current Massachusetts phase is at to go to whatever the next reopening phase is? So the more relaxed restrictions? That's not clear to me here at all. I'm assuming that every county could have a different stage they're at. So I guess I didn't think of reopening as being binary. I thought everything was kind of in phases. That was my understanding, at least from our local, what's happening, from what I hear from the governor here in Massachusetts. So not super clear on what data is here. I don't know if the average person is going to be thinking about it quite that heavily, but that does make me wonder here. So it looks like the risk is medium. This kind of thing, I mean, this gets in kind of to the explainability aspect. I'm wondering if this is case trend decline, diagnostic testing, and occupied hospital beds. So is that an aggregate index of 3 of the metrics that are on this page? I'm not sure. It might be nice to know if there's a way to push a little bit of the explainability here as to why the score is high. I understand that might be difficult to do, but just, if it said like, the beds are in very high demand, there's no hospital space or something like that, that might be kind of neat, but I understand that could be difficult to do. Okay, so I'm going to keep going through each of these. So back to school recommendations based on planning for on-campus K-12 education during COVID-19. So you've cited some, looks like there's a PDF, I'm just looking down below, that you're referencing here. That's interesting to me. It's interesting to me that knowing both of these counties and knowing how much worse I believe Arizona's situation was than where Middlesex has been, that this says use virtual learning. That feels strange to me. Our case numbers, I think, had been doing quite well relatively to a lot of the rest of the country, so I'm kind of surprised to see this, but maybe this is explained down below. So yeah. Small other thing too, I like that these are large, but just again, some graphic design comments. I feel like this type doesn't need to be bold and this big. It can just be large. I don't think it needs to be bold though too. And the gap between the metric and the icon, it just feels a little bit not polished. So it feels weird. Like for example, why is L capitalized here? It just, they're the fit and finish kind of things, but I do notice them. So these dates too, I kind of feel like I think I mentioned this in a previous one. I kind of feel like I want to see it in count of days since now. So a relative date based on now. So if this would say as of 4 days ago instead of August 24th. It just gives me a quicker idea without having to process the number. What date is it today? And then I have to do mental math. I don't really care what the exact date is. I just want to know how fresh the data is, and that helps. Understanding it in terms of a go helps me do that, in my opinion. Okay. What is the status of the outbreak? 7 per 100,000, 6 per 100,000. Got it. And those aren't great. We're kind of in the middle. Case trend. The trend of new cases over the past 14 days. So I think when I saw this, I was curious about this data. I kind of wondered if there was a reporting incident because it looks like there was no cases reported. I think these are all the samples, right? So there's no data, and then there's a big backlog of data that came in on this date. So it made me think that maybe there was some kind of data source problem here. which, yeah, I don't know. You guys could probably do something about calling that out, because some people may not care about the trends, but it may be misleading to say there's an incline, because this spike, I mean, I guess technically it looks like in the last 5 days there's still an incline here, so maybe that actually wouldn't have mattered, and there still would be an incline here based on this information. So, but that type of outlier might be something you'd be able to catch in the analytics. All right, near zero decline or flattening. So Phoenix is actually doing pretty well since the end of last month. They really started to trend downwards. Looks like they keeps finding a bump up and they're squashing it down. So that's good. State diagnostic testing positivity rate. The trend in the percent of positive diagnosis over the last 14 days. So less than 3%. Yeah, so they're pushing down. Oh, it's a 2-week period, right? 2-week period. Okay. Yeah, this makes sense to me. I get this. Yeah, you wanted to talk about trend. What I've been thinking about right now was the fact that you're printing a number here and you're not printing a number here, but I understand it's an overall trending direction. So another way you might think about this too is, I wonder if like I just feel like, well, why isn't there a down arrow and an up arrow? It's just like, I don't know. I felt like I wanted to see like an arrow just kind of just as a really quick visual to help me understand what the overall trend is. And that may be overkill and not necessary. I'm very much nitpicking on that. Reproduction RT, right? How many more case result value? Yes, I know what that is. Okay, so looks like Middlesex is doing a little bit worse. Interesting. The margin of error seems to be a lot higher here than it is in Maricopa County. But yes, that I understand what that is. I'm curious to know that was actually popped up a little bit since the last time I looked at this, although it looks like it's come down in the last week or so. Okay, death trend. The trend in deaths over the last 14 days. Yeah, I mean that's all good. I think I get what that's saying. I think that's good. I wonder if the word flat suggests I kind of wondered if it might have suggested something like 0. And it's not 0, it's really no. I'm interpreting it to be no change. It's like it almost feels like steady. And again, this may be totally fine. I would not just change this interface based on my feedback. I'd want to run this by whoever the users are, do a couple tests. But I wonder if flat could kind of feel like none instead of steady, because what I think you're trying to say is that the number of deaths is about the same day after day. That's what I think the summary of this is. I just don't know if that's what someone would necessarily take with that label. So maybe worth checking out. Again, this is overall, I think it's really good what I'm seeing. So I'm very much, these are nits. So are people complying with social distancing? How many NPIs are in place at the state level? 4 out of 7? 1 out of 7. Interesting visual. Are you plotting this every day? I understood what this is. I just thought it was kind of interesting to think about it this way as a continuous line, but I guess that's technically makes sense. They do that could change. Yeah, that's probably okay. Shelter in place. How many people are sheltering in place compared to February? More, little change, or less? Um, yeah, I think that's good. I understand what that means. I like the presentation. I like how this is indexed to kind of, yeah. Uh, it's kind of interesting. So what I'm thinking about right now is I get what this is like here. When I think about, oh, compared to February, so I guess February is the baseline. Is this zero axis here is in the middle of the chart, and that's so it's like an over under chart. Um, yeah, I was just thinking kind of like I guess I was thinking 14 days, and I was wondering why it's not indexed to zero. Like why didn't it start in the middle? But I guess what it means is we've been consistently more, at least since July 31st, we've been sheltering more than what we were in February. So I get that. That's okay. What is the surge capacity of the healthcare facilities? Percent of occupied non-ICU beds. Um, yeah, I understand what that is. So about 3/4 of our non-ICU beds here, almost the same in Phoenix. State occupied non-ICU by COVID patients. Got it. So there's, yeah, I understand. I understand that. State occupied ICU beds. 50% occupied. Yeah, I get this. I know why you broke this out I know why this is broken out over four of these panels. It felt like this is a lot of real estate to communicate this much information. Um, Maybe it does make sense to break it out, and maybe there's a reason to think about it this way. I guess I wonder why it matters to separate COVID from non-COVID patients, because I guess I thought the question would be, is there a bed available or not that can support me? Does it matter what type of patient's in it or not if it's not something that could accept a patient? So I don't know. I guess I'm not clear. There must be a use case for why you want to know this, or I don't know what the metric is that you want to understand. I could understand a hospital wanting this information. This gets back to kind of like, who is this for, right? It answers a lot of different questions. So I can imagine, even though I can't personally relate to it, why someone may want this information, I guess, and maybe why they'd want it separated out. It did feel like maybe there would be a way to combine the COVID and non-COVID stuff into one panel. So forecasted N95 mass demand over the next 3 weeks compared to the previous 3 weeks based on a model. Okay. Yeah, I remember this from the last time. These anytime I see these huge values with no commas, they just kind of, it just feels really complicated. Either round this up to K, 639K or 640K, or put a comma in there. I don't know how much you really need at that scale. I don't know why you need that level of precision. I guess for a chart like this, it doesn't seem to help, in my opinion. Um, Yeah. Might be good to delimit where now is on this chart as well. I do remember we talked about this, so I won't go way into this. Now is going to feel like it's at the end of the chart. I understand you use some color for that. I kind of feel like I want to see a vertical delimiter, some kind of graphical representation of where now is, a red line or something. I don't know why. And I wonder if you could just use -1, -2, -3W or something like that. I mean, again, I'm just knitting here. It's pretty small stuff. I understand the concept of what this is communicating, so I think that looks good. Yeah. Okay, I'm going to keep going. What are the socio-economic impacts of the outbreak? Virtual learning. Percent of households with high-speed internet access, including cellular. 82%. 71%. Okay. It's kind of interesting that I'm always wondering, like, who decided that 50 to 75% would be kind of okay and that 75% totally not your problem? I'm sure someone else probably made those decisions. I don't know. I guess the government has some standard about that. So, that's a new stat. So that's fine. Consumer spending, how much people are spending with consumer credit and debit cards compared to January? Little change. Yeah, I really like this relative way that you present the data, where it says little change. I think that's really friendly, and it's easy to process what it means. So I think that's great. I like the comparison to the baseline here. So yeah, I think that's great. Unemployment rate change. Percent change of people in the labor force that are without work now compared to this month last year. Got it. So yeah, I wonder why is there a gap between the amount and the X? That feels a little weird. I kind of feel like I don't want a space here. I love that you guys printed the absolute value and the multiple here. I think that's really powerful. Yeah, I understand that. So these other, I'm scrolling back up here. I'm guessing this turns on a whole section of statistics that you guys have, like vulnerable. I'm expecting, so I know I'm jumping around. I'm expecting one of these headings to turn on based on this. So I'm going to just do a find for vulner. Actually, that didn't do anything. So I don't know. Yeah, this is back to my comment. I have no idea what this is turning on and off down below here. Another just super small nit, but because you're changing the typeface here, this stuff is this stuff is flashing a little bit. It's just because the extra pixels and the weight, the typeface weight, are actually pushing the spacing out. So yeah, it's kind of minor, but just you could probably figure out what the extra white space is here and use, there's a different box model I think you can use in CSS to handle that. Super small, but the rest of this looks pretty good. Again, I probably wouldn't, again, I'm not so interested in this map. It's not in the way, I guess. I mean, you can just scroll it off. It's probably the best place to put it. I mean, looking at kind of the format you've used for the dashboard, I get it. It's also the way that you kind of get into the data. So maybe in hindsight, I'd say it's fine. Yeah, I think I'd probably just leave that the way it is at this point. So you might have sold me on that. But overall, yeah, I think this is pretty good. I think I don't remember all the changes that we talked about. I've probably gotten used to some of the things that I originally called out in this, but I think there's some really great changes that you guys have made to this. So congratulations to the MITRE team and the COVID-19 Healthcare Coalition people that are working on this. Yeah, so I think that wraps up this audit for now. I will post more of these on my YouTube channel. So if you are interested in content like this, or other insights, I do publish to my mailing list, designingforanalytics.com/list. I'll put a link up in the notes below the video if you'd like to follow my work or check out the podcast Experiencing Data. Okay, take care. Bye.